Bismillahirrahmanirrahim. I am Professor Harun Hamid, Chairman Department of Pediatrics, King Edward Medical University. I welcome all of you to the final year MBBS, your last year towards the beginning of a new era as doctors. So this is the first lecture of pediatric medicine, first in the module 1 of your final year. And in this lecture, we are going to talk about little bit about the background of pediatric medicine, introduction to the statistics and various terminologies. So what is pediatrics? It's a discipline of medical sciences which is dedicated to all aspects of well-being of infants, children and adolescents. This includes not only their physical, mental and psychological health but also to their growth and development. Now, pediatrics has got two main branches, pediatric medicine and pediatric surgery. As the name is clear, pediatric medicine deals with the medical aspects and pediatric surgery with the surgical aspects. Of course, we have a lot of subspecialties in both of them, including the neonatology, cardiology, endocrinology, so on and so forth. So introduction to the faculty of pediatric medicine. In addition to myself, we have Professor Iftikhar Ijaz heading Unit 2 of pediatric medicine, and we have a host of faculty members who will be teaching and tutoring you throughout your final year. Of course, do not forget your coordinators, Dr. Bushra Ahmed from Unit 1 and Dr. Anila from Unit 2. You would get to know them as you go along. They would be coordinating all your classes, your attendance and all the other details. So as far as final year MBBS is concerned, we used to have morning lectures and we were supposed to have total of 36 lectures that we are going to try and cover in the virtual lectures, and they would be disseminated to you through the Google Classroom. I would also urge you to subscribe to the YouTube channel where these lectures would be available even after this Google Classroom, and you can always go back and listen to the lectures and clarify your concepts. In addition to that, we have ward and clinical teachings, which as of now, because of the COVID pandemic, we are suspending them. But I'm sure that we are going to start your clinical teaching soon, and this is something which is very valuable and very important for you. This is going to transform your theoretical background and knowledge into the clinical practice. And these are the sessions which I urge you to attend with all the zeal and all the zest. So this clinical teaching would be not only the pediatric wards but also in outpatient department and the preventive pediatrics. We have since last year we have started this 2 weeks clinical rotation in pediatric emergency, intensive care and neonatal unit, which the previous final year they liked it very much because you are not taught in these 2 weeks time, but you get to know how the patients are assessed, how the patients are managed and how they are counseled and all that sort of bits, which would be very helpful in your practical life. When we start face-to-face classes, you would have these evening classes in the emergency room and the wards, where you are supposed to learn and practice clinical methods. Research and audit, though not mandatory, but we encourage students to involve themselves in research and audit as well. As regards your final professional examination in the subject of pediatrics, there would be 20 marks for the internal assessment, and that would include assessment of your attendance, your class test, your ward test, and your emergency room logbook when you go on 2 weeks rotation to emergency. The theory paper comprises of MCQs and SAQs, and that carries 90 marks. And then there is clinical and practical exam, which also carries 90 marks, 30 for long cases, 30 for short cases, 20 for OSPE, and 10 for Viva. Now this is the format on which you would be assessed. So I urge you, all of you, to prepare your subject of pediatrics on these lines so that all of you can go through and pass through the exam very well. So the modular component There would be 9 modules spread over 32 to 34 weeks, and there would be 2 large assessments, a midterm assessment and the end of the term assessment. And these are the modules. In the first module, we are going to talk about infections, surgical care in hematological disorders. Second module would be cardiovascular and the related diseases. Third would comprise of CNS, respiratory and hematology oncology. Fourth, acute medicine and trauma. Fifth, endocrine and breast diseases. Sixth, GI problems. Seven, hepatobiliary and pancreas. Eighth would be elective or orthopedic and rheumatology module, and the last module would be the renal module. These are the learning objectives. You can find them on the website of King Edward Medical University. Now, today we want you to learn some important nomenclature in pediatrics, and we want you to recall your knowledge of community medicine regarding the important statistical information, the basic parameters and the health related statistics of Pakistan. We are going to touch upon the importance of pediatrics and its difference from the adult medicine if the time allows. So, what is a child by definition? Anybody? So, technically speaking, and legally speaking and constitutionally speaking, an individual till the age of 18 years is considered child. But for all practical purposes, in our pediatrics ward, we deal children till the age of 16 years. And a neonate is a newborn till the age of 28 days, and infant is the one till the age of 1 year. Toddler, as defined by Wikipedia, is 12 to 36 months of age, although there are different definitions of toddler, and adolescent, all you understand, is 10 to 19 years of age. Now, this perinatal period is very, very important, because perinatal period, you need to understand that there are various issues and problems, if they occur in the perinatal period, would impact the children not only in their neonatal life but also in their infancy and sometimes throughout their life. So the perinatal period starts from 22nd completed week of pregnancy. So it is from in utero to 7 days after birth. So this is the important period where even a trivial insult to vital organs like, for example, brain, can have long-reaching consequences. The 3 other terms that I want you to understand, of course, you would study them in obstetrics as well as far as the gestation is concerned. Now the babies are divided in 3 categories as regard their gestation. A full-term baby is the one who is born between 37 and 42 weeks of gestation, is considered a full-term baby. A preterm baby is one who is born before 37 completed weeks of gestation, and the one who is born after 42 completed weeks of gestation is a post-term baby. Similarly, there are certain terms that you need to know as regard the birth weight of the babies, because they have got their implication not only in the short term but also in the long term. A baby who is born with a birth weight of less than 2500 grams is called a low birth weight baby. If the birth weight is less than 1500 grams, this is called very low birth weight baby. And the one who is born less than 1000 grams is extremely low birth weight baby. In addition to the gestation and the weight as such, the third important terminology is weight for gestation, which means that at each gestation, at 37 weeks or 35 weeks or 36 weeks or 30 weeks or 28 weeks, a normal baby is supposed to have certain weight. If that baby is having that certain weight, then we call it appropriate for the gestational age. Now, this would mean that the weight of the baby for that gestation lies between 10th and 90th centile for that gestation. And I hope that you understand from your knowledge of community medicine what these centiles are. Otherwise, we are going to discuss about the centiles in subsequent lectures on nutrition, growth and development. So if the baby is born with a birth weight which is less than 10th centile for that gestation, this baby is called small for gestational age, and if the weight at the time of birth is more than 90th centile, that is large for gestational age. Now remember that not only the birth weight per se is important for their morbidity and the mortality, but also the weight for gestation is important. For example, if a baby is born preterm, it would have implications. Similarly, if the baby is born low birth weight, less than 2500 grams, it would have implication. But suppose a baby is born full term, but the weight is not appropriate for the term, then the baby is called small for gestational age if the weight is less than 10th centile, and large for gestational age if it is more than 90th centile. And in both instances there are implications which are linked with small for gestational age or large for gestational age. Health indicators, I'm not going to go into the details of that. You have, I'm sure you have read about them in your community medicine. But what is health per se? Health is a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. And there are various health indicators which provide us a numerical measurement of various aspects of health within a population for a specific period, normally for a period of year that we talk about. There are various health indicators which actually measure the health of the community, and they compare one community from the other community. They give you an assessment of the healthcare needs, and with that you can properly allocate the resources, maybe the human resources or the non-human resources. These indicators also help in monitoring and evaluation of the health services, activities and the programs. These are a list of health indicators, and this is not an exhaustive list. There are so many other health indicators. But for us, one of the important health indicators that we give a lot of attention is the mortality indicators. Now, the mortality indicators are: one is the crude death rate, number of deaths per 1000 population during 1 year, for example, 7.5 per 1000. From pediatrics point of view, there are three which are very, very important, and the fourth which has got its own importance. The three important ones from pediatrics point of view are under 5 mortality rate, infant mortality rate, and the neonatal mortality rate. Of course, maternal mortality rate has got its own implication, not only to the society, to the mothers, but also to the family and to the children. Now, infant mortality rate actually means the annual number of children less than 1 year of age who die per 1000 live births. So this is the annual number. So number of less than 1 year who die per 1000 live births in a year is called the infant mortality rate. This is an important health indicator because this gives you an idea about the whole of the population and the socio-economic condition. This indicator is actually considered a very sensitive indicator of the socio-economic and the health condition of our population, the infant mortality rate. This is important because of its availability, utilization and effectiveness. Now, infant mortality rate worldwide, the two leading causes of infant mortality are pneumonia, the lower respiratory tract infections and diarrhea. However, in developed countries, because they have controlled these infections, pneumonia and diarrhea over there, the causes are congenital malformations, some other infections, especially the neonatal infections and sudden infant death syndrome. We have talked about infant mortality. Perinatal mortality, the total number of deaths of the fetus from the gestational age of 22 weeks to 7th day of life is called the perinatal mortality. And if an infant dies within first 20 days of life, this is called the neonatal mortality. And the postnatal deaths, which include deaths after 28 days of life, but before 1 year. And the child mortality is all deaths in children under the age of 5 years. So the two most important would be the infant mortality and the child mortality, deaths under 5 years. Of course, neonatal mortality is also important, which occurs in the first 28 days. UNICEF has enumerated the causes of child mortality, which include pneumonia, diarrhea, malaria, measles. Malnutrition is common to many of them. Actually, 30 to 40% of children who die within the first 5 years of life may be malnourished. And then there are the perinatal disorders, which are the leading among the leading causes of child mortality. Now, this picture gives you an idea of the split of deaths in children under the age of 5 years. You can well appreciate that 40% of the deaths in children less than 5 years occur in the neonatal period, and these are because of prematurity, asphyxia, sepsis, and other conditions. And beyond the neonatal period, the leading causes are the pneumonia and diarrhea and certain other infections. Now, this actually also reflects the same scenario. It's from WHO and UNICEF global research, and you can well appreciate that there are large number of diseases in this death cycle which are preventable. Infections are preventable, as you all understand. But asphyxia, as you would learn, is something that is very much preventable. Prematurity is not only preventable but is very well manageable. So we need to understand. So the big chunk are the diseases which are preventable, and if not preventable, are very well manageable if appropriate attention is given. So it's the preventive aspects which plays a very important role in decreasing the mortality in children and infants. Now, the other important aspect that you need to understand are the nutritional indicators. Nutrition status of a newborn is assessed by three important parameters: the birth weight, the length, and the head circumference. I think we'll keep on talking about these things, and we want you to learn these things because they have got its implication. So, generally speaking, when we talk about, for example, birth weight, a full-term healthy newborn generally would weigh around 3 kilograms. In Western population, it is between 3 to 3.5 kilograms, and in our population, it is estimated to be between 2.5 to 3 kilograms. So that is for a term healthy newborn. Now remember that this weight would double by the age of 5 to 6 months and would be 3 times by the age of 1 year, and should be 4 times the birth weight by the age of 2 years. And if that is not happening, that means there would be a problem with the nutrition of the infant or the child. Similarly, head circumference gives you very important clues of what is happening with the neurological and the developmental aspect of the infant. For a normal, healthy term newborn, the normal head circumference is between 32 to 35 centimeters. It increases by 2 centimeters each month for the first 3 months of life. For the next 3 months of life, that is from month 3 to month 6, it increases by 1 centimeter per month. And for the next 6 months, it increases by half a centimeter per month. So by 1 year, the head circumference by this calculation would be 47 centimeters. So these are the important figures that you need to understand. So the nutrition status of preschool children, especially under the age of 5 years, they would be assessed by these parameters: the weight, that means weight for age, and the height, height for age, and the mid upper arm circumference. Now the weight for age actually measures acute malnutrition, and height for age measures presence or absence of chronic malnutrition, and mid upper arm circumference again measures the chronic malnutrition. Now the growth monitoring of children would entail measuring the weight for age, the height for age, the weight for height. Now this is another very important parameter, the weight for height. So even if, for example, the weight of the child is alright for that age, the weight for age is alright, but the weight for height is less, that would mean that the child, although is growing alright from the age point of view, but is not, the weight is not appropriate for his or her height. So they need to have appropriate weight not only for the age but also for the height. So remember, so if the weight for height is less than certain centiles that we are going to discuss in subsequent lectures, then we call this condition as wasting. And if the height for age, the height of the child for that specific age is less than the desired height at that age, this is called stunting. So remember these terms, wasting and the stunting. Of course, we have talked about the head circumference and the mid upper arm circumference. We are going to talk about that in little more detail. Now, these are the health statistics of Pakistan, and I can tell you that these are not the latest statistics. And one of your tasks after this lecture would be to find out the latest health statistics, especially the neonatal mortality rate, the infant mortality rate, and the under 5 mortality rate. Now, one thing that I want to say over here, and I always talk to the final year when I talk to them in their lectures, that all of you are, mashallah, adult learners. We are not going to spoon feed you everything. We will give you a little indicators, and we would urge you to find out more knowledge about that. Now, one example is these statistics. That would be your task. So we have talked about what neonatal mortality rate is, what infant mortality rate is, and what under 5 mortality rate is, and I have given you little old figures of Pakistan's neonatal, infant, and under 5 mortality, and all of you are supposed to find out these rates, the current rates of Pakistan, from reliable sources. And when we say reliable sources, that means WHO, UNICEF, or health statistics from government of Pakistan. And you all very well know, you know better than me how you would find them out. If you have any difficulty, let me know. I can assure you this finding of the latest rates would not be from your textbook. And talking about textbook, let me tell you that I wanted to say in the beginning, but I can talk about that here. Which book or books are you going to read as far as pediatric medicine or pediatrics is concerned? There are a couple of books that I urge all of you to have with you, and that will give you a broad overview of the subject. But for the latest thing, there is literature, reliable literature available on the internet. You can always Google that. And the books that we are talking about is one book of pediatrics by Professor Pervez Akbar. There is another very important book that has just come out few months back, but that book has input from all the senior professors from all over Pakistan. That is Textbook of Pediatrics by Pakistan Pediatric Association. That is something which is very, very important. In coming months and years, we are going to talk more about the various aspects of pediatrics from this particular books, and perhaps some of your test and your examination would be from that book as well. So we have given you the task as well. Now we have talked about the stunting and the wasting. One very important thing that I want you to understand is exclusive breastfeeding. Exclusive breastfeeding rate in Pakistan is 38%, which is quite dismal. It has to be higher. And exclusive breastfeeding means that giving breast milk to the newborn till the age of 6 months and nothing else other than the breast milk, not even water. This is very important for the health and well-being of the infants. Now this picture gives you an idea of what is happening with our health statistics over time. Now this orange one is 1990-91 survey, Pakistan Demographic and Health Survey. The blue one is 2006-2007 survey, the red one is 2012 and 2017 survey, and this purple one is 17-18 survey. You can well appreciate that there is improvement in under 5 mortality. Under 5 mortality has decreased from 112 to 74. Same is true with the infant mortality, decreased from 86 to 62. But the progress from neonatal mortality point of view is not very good, and this is an area of much concern that we need to pay attention to. This one also shows you the trend in childhood mortality, especially and special emphasis to the neonatal mortality. This red one is the neonatal mortality, and you can well appreciate that it is more or less static. Also, there is some improvement in the mortality of other age groups. Now, we being part of the Global Alliance on Health, the Sustainable Developmental Goals, and the Goal 3 targets the health indicators, and we need to achieve this goal by year 2030, just 9 years from now. And the areas pertaining to the pediatrics health is reduction in neonatal mortality rate to 12 per 1000 and under 5 mortality rate to 25 per 1000. And I have just given you the figures. You can well appreciate that we are very far behind from achieving these goals. This slide also displays a very important figure that Pakistan ranks the highest as far as the neonatal mortality rate is concerned, which is very disappointing for us as a nation. Just a graphical representation, the global representation of the neonatal mortality and the under 5 mortality. Now, if we continue having the progress I have shown you in the graphs, the way we are doing, then we would not be able to achieve Millennium Development Goal by the year 2030. We are supposed to gain it over here. The rate by which we are improving, we are going to achieve this target not earlier than year 2075. So, food for thought for all of the policymakers, the healthcare providers, the professionals, and the students, and the future scientists. So we stop here. We have talked about, well, we have not really talked about the importance of pediatrics, but we'll keep on talking about the importance of pediatrics. We have talked about some of the important definitions and some of the health indicators, and we have talked about the childhood indicators, and we have talked about where do we stand as of now as a nation. Thank you very much. Remember, one of the tasks I have told you, then there would be other tasks that you would have to complete. We will give you sufficient time to complete your task, and once you have done that, your attendance for this lecture will be marked. Thank you very much. If there are any questions, you are more than welcome to post them on the Google Classroom, and we would address those questions in due course of time.